It's 2 years and 7 months since a fire consumed the maternity ward of Chiunga Health Centre Full, leaving the facility in ashes. Joy Mutaulu keeps moving around this area where she has worked since 1993 as a midwife to monitor the progress made in the ongoing construction.
I was inside the building asleep and I didn't know what was taking place. Then all of a sudden I had somebody calling me, "Musau, Musau." Then I had to answer. He said, "Come out, the building is burning." So I had to come out. I'm sorry, I came out naked as I was born.
Fortunately, she was safe. She escaped unscathed, and so did the mothers and babies who were in the building that night. However, the challenges of maternal and newborn health intensified at that very moment. For 1 week, they took a break, and in that week, many pregnant women had to find options.
And we used our staff quota to work as a maternity, so we've been sharing.
One problem with the congesting patients in such buildings is that infection control becomes very difficult. Privacy becomes very difficult, and these are very vital.
We walked to what became a maternity ward. A glance from afar revealed a rundown shack. It's bereft of many things a well-equipped delivery place ought to have.
Mothers who are used to come and they are delivered there, the numbers have reduced. Now even in theatre, those ones who could be operated on, we don't have where we can keep them post-operatively.
The authorities refer them to other hospitals in Iganga or Jinja district.
And Luuka is one of the poorest districts. Telling somebody that we are being referred, that one also, some of them go, some of them fail.
Dr. Enokwikeriza is the acting district health officer of Luuka. He has no kind words for the district's healthcare system.
But we would close it.
He says the district has 1 health centre full and 6 health centre 3s, but the infrastructure is very much wanting.
You can't see the outpatient, you can't have inpatient, you can't have maternity within, you can't have antenatal.
Staff accommodation is non-existent.
That is why our clients complain that facilities are closed early. Over the weekends they are not working because these people stay far.
The district doesn't have an ambulance and its road network is in a very poor state. The area is also grappling with poor mobile phone signal. The drugs at health centers are inadequate to serve the big population.
You saw what happened when we had a camp organized by the Chebazinga and the Tabingwa and the well-wishers of Luuka. Many people turned up and we wondered where they have been because they were really sick, they need a service, but with that camp they were assured that drugs are there. And the turn-up was very good.
When you listen to all the challenges, you may come to one conclusion, that they affect reproductive health mostly, and getting pregnant in Luuka is a nightmare, especially after the maternity ward got burnt.
But sometimes, when need be, we are forced even to work on those mothers in whatever circumstances.
So when they come and they find the only 1 delivery bed occupied, there is no option. They deliver under mango trees.
Dr. Kwikiriza has challenged the people of Luuka to demand for the right to access health services.
So now, maybe as the political pressure rises, let them look at what they can give the Luukarian. But if they are not doing it and we need it, this time it will be an agreement between the people of Luuka and the politicians. No maternity, no vote. And we don't need words, we need action. Say you are going to do this, come and start it.
Actually, the whole district entirely relies on this health center. And as you may know, Health Center 4 is basically maternity.
Men are active.
I think on the issues of health, especially maternity care or maternal and newborn care, we cannot wait.
Dr. Peter Weiss, an international expert on maternal, newborn and child health at Makerere University School of Public Health, understands Dr. Kwikiriza's displeasure.
And for the last few days, I've actually been going around hospitals in Busoga. And particularly in Iganga Hospital, we have looked at all mothers who come to have a cesarean section. Quite a significant number are coming from Luuka. And also among maternal deaths in Iganga Hospital, most of them would have come from Luuka with some delays.
Busoga region, like many other regions in the country, has a poor healthcare system.
We've actually done a survey over the last 2 years, how many women have delivered in a hospital, not a lower health facilities, and how many have died. And we found that these hospitals are quite busy, delivering up to 20,000 women a year.
Maternal mortality remains very high.
Last year they had 30 maternal deaths, just one hospital. And from my investigation, there are a couple of critical things. One, like the last 2 months, there were no drugs in these hospitals. Two, blood. Blood has been a major problem. People run everywhere and there's a lot of corruption around the blood. People are selling blood. And then the system for distribution for blood is not the same as for drugs.
The region doesn't have a blood bank.
And of course, we are on a highway. Really, the region would benefit from having a regional blood bank.
This would tremendously help improve maternal health, along with having other measures like family planning in place, poverty alleviated, and combating illiteracy. Florence Nalimba, NTV.